Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a palliative care nurse talking to an elderly patient. Now read the question.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
Question 26. You hear a pharmacist talking to a customer who is in pain. Now read the question.
Good morning. Can I help you?
Yes, I've been in a bit of pain. I've got arthritis, you see, but it's not that, it's my jaw.
Oh, have you had this problem before?
Yes, it flares up when I get anxious and, I'm a bit stressed at the moment. I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication.
Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. But you're right. Taking that is not getting to the root of the problem. Have you seen a dentist or a doctor about this?
Yes, I've had a bite splint at one time, but, it never really helped.
Well, I'd recommend seeing someone about it again because this can become a chronic problem.
Okay, you're probably right. Thanks so much.
Question 27. You hear a dietitian talking to a patient about a new treatment plan for diabetes. Now read the question.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables, but the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
Question 28. You hear a senior nurse advising a trainee about a condition called venous thromboembolism, VTE. Now read the question.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is short of breath, but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
Question 29. You hear an eye specialist talking to her patient. Now read the question.
Now, Mr. James, looking at the latest images of your eye, I'd say there are signs of improvement.
Well, I'm not completely cured, but there's less distortion in my vision. That's a huge relief. I could barely recognize people in the early stages. I'm still not confident about night driving, and I know I've lost color perception in the center of the affected eye. Everything's grey. I notice it when I close the other one.
Well, that's certainly what the images suggest, and what you describe is entirely to be expected. Despite the fact that your eye's recovered up to a point, there will be permanent damage to the retina. Instead of lying smoothly against the eye's inner surface, it'll stay a bit wrinkled, which would explain your symptoms.
At least my vision's clearer than it was. I'm grateful for that.
Question 30. You hear a cardiologist updating hospital colleagues about trials of urine testing. Now read the question.
As you're aware, many of our outpatients struggle to take their prescribed hypertensive medication, so we've looked into the reasons for unintentional lack of compliance. We discovered that one of the key reasons for patients forgetting to take their tablets was because of the number of pills required. Reducing the amount prescribed isn't possible, of course, but something as simple as urine testing to monitor patients is proving an effective intervention. The results of our trials show that over 50% of patients undergoing urine testing became completely adherent to their drug regime as a result, which, of course, leads to better outcomes. This is an important breakthrough, given that previous studies showed limited benefits for high-risk patients from complex and costly alternatives aimed at reducing rates of stroke and heart disease.
That is the end of Part B. Now look at Part C.